Bienvenue à ChangeNOW and welcome to yet another pitching session today. We've had a firework of exciting ideas already throughout the day on water and the ocean, on agriculture, on education, on mobility, and no conference about societal, environmental and social issues is complete without speaking about health. Because without health, everything is really nothing. And so for the next roughly 1 hour, we are going to see an exciting lineup of ideas and innovations in the field of health. This session is done in partnership with UCB, and we have Annelien with us, a big pleasure. And I'd love you to just tell us a little bit about yourself, UCB, and this session. Thank you.
Thank you. Hi, good afternoon. So I'm Annelien, representing UCB today. UCB is a global biopharma company where we help people living with severe diseases to live the best life they can. And in my role as an innovation partner, I get the chance to every day work on challenges and help get care more accessible and effective for people around the world. Our participation in ChangeNOW is a testament of our commitment to sustainable performance, and this event really allows us to collaborate with change makers like you to exchange and talk about how we can help move healthcare forward. I really want to thank you all for this opportunity to connect and collaborate, and I hope we can continue the conversation also beyond this pitch session so that healthcare is not just to serve it, but becomes an integral part of our life. Thank you, and looking forward to all the pitches.
Wonderful. Now, besides Annelien and UCB as the partner, we have another group of people who play a special role in the next 1 hour, and that is our esteemed jury. Now, short and sweet, maybe just 20 seconds each, starting on my right. Tell us who you are and who you represent.
Samantha. I'm a partner at Laia. Laia is a European-based VC firm that invests in early-stage B2B tech companies from pre-seed to Series B, from a couple hundred K up to 15 million first ticket, then we keep for follow-ons. And we have a huge vertical on digital life science.
Wonderful.
Hello, my name is Agnès Deler-Snider. I'm the CEO and co-founder of Future for Care, which is a joint venture between Orange, Sanofi, Capgemini, and Generali. We're here to help care startups in digital health. We now have 50 startups in our portfolio.
Wonderful. Good to have you. Welcome.
Hi, I'm Laurence Loom. I'm a European patent attorney at Plasro IP. Plasro is a global European firm, is a one-stop shop for anything intellectual property related, that is patent, trademarks, domain names, contract. And we service startups and we help them to get started with their IP.
Wonderful. Everyone needs a lawyer in their corner, so that's very good. Good to have you.
Good afternoon, everyone. I'm Baudouin, partner at Carista. We are managing venture capital funds, investing from seed to Series B. And actually, we have dedicated funds for the health tech topic, which I'm leading.
Wonderful. Welcome.
Hello, everyone. I'm Shemina Asmina. I'm heading the venture capital team for Europe and Latin America at BNP Paribas Cardiff, so the insurance arm of the BNP Paribas Group.
Wonderful. So much expertise and knowledge. Good to have you. Thank you. My name is Matthias. I have the pleasure of moderating this session. In my day-to-day life, I'm also the founder of a big support network of social entrepreneurs and activists. We provide access to networking, to resources and capacity building to about 1,300 social enterprise and social entrepreneurs around the world. And without further ado, I'd love to ask the first person up on stage, and that is Justin from Landcent Europe. Your time to shine.
Thank you. Hi, my name is Justin Hayes, and I'm here representing Landcent. Landcent is a social enterprise based in the Netherlands, and we focus on accelerating the fight against poverty-related diseases. Our story begins back in 2011 when our CEO, on a business trip to Kenya, found himself at the funeral of a 4-year-old girl who had died from malaria. Fast forward 5 years, and he was back in Kenya with his co-founder at the Kenya Malaria Strategy meeting, showcasing their first solutions to fighting malaria. Malaria is a crisis that's hiding in plain sight. Last year alone, there were over nearly 250 million cases of malaria, and 1,700 people die every day from malaria. And since most of those people are children, it equates to roughly a child dying every minute from this disease, and that makes it a human rights issue for us. There's two key reasons that the world is losing the fight against malaria. One is a lack of product innovation, and the second is a growing resistance to the insecticides that are being used. Landcent is uniquely positioned to address both of these. First, we have a portfolio of next-generation products that provide a holistic approach to fighting malaria using WHO-recommended strategies. For example, Duris, our indoor spray, uses a patented encapsulation technology to deliver twice the residual effect of the alternatives today. But we also have a longer-term strategy in partnership with the Bill and Melinda Gates Foundation, where we've developed an active ingredients discovery platform to look for new classes of biopesticides. And we've expanded this platform, now using machine learning and artificial intelligence, to look in indigenous knowledge systems for new drug candidates as well. We have an experienced and diverse leadership and advisory team. We have raised over 18 million to date. And by 2028, we're projecting to reach over 80 million in revenue, with a break-even occurring the year prior in 2027. We're here because we're looking for $10 million in a Series A. About half of that has already been committed to us in soft commitments, so we're here for the other 5 million. And because malaria is a disease of poverty, it touches on many SDGs, but our impact is actually very precise and measurable. And by 2030, we hope to be able to protect 130 million people, including 65 million children. Our business model is validated. We have several partners, and we'll hope you'll consider joining us as well. Thank you.
Right on time. Thank you, Justin. It's okay. Thank you. Wonderful. Wishing you all the success in the world. Next up is Puskarini from Loba. The stage is yours. Welcome. Thank you.
Good afternoon, everyone. Good afternoon, dear member of the jury. My name is Puskarini, and I'm the head of advocacy unit for Loba. Did you know that 75% of immigrant women report having been victims of sexual abuse? And did you know that 80% of victims of rape present PTSD? So whether in the country of origin or during the immigration journey or upon arrival in France, women are extremely exposed to sexual abuse and violences. For that reason, they may present many and significant consequences for which conventional therapies may not be adequate. Moreover, professionals in the medical and social sector are often ill-equipped because they lack resources, because of poorly training, or because there is no following up in the psychiatric sector. So how do you think these women arriving in France without any rights, without any papers, can cope when mental health sector is struggling, when there's an ignorance regarding their traumas, and when professionals are not properly trained to address these specific issues? Loba was created by two Franco-Congolese men that face discrimination based on their racial and social background. And as professional dancers, they believe that art is an incredible tool for social transformation. That's why they created Recreation Project, in order to allow women to empower through dance as therapy. Those workshops are facilitated by a pair of co-therapists, a dancer and a psychologist, enabling women to articulate their thoughts, to regain movement, and thereby to connect body and mind. In addition to the benefits derived from physical activity, dance is a new means of expression to externalize pain, to tap into the ability to create and also to envision themselves bodily in a new space. So today we are convinced of the benefits of our workshop, and we even have undertaken a 3-year study to evaluate the impact of the therapy on our beneficiaries. And as we have the growth demands and requests, we need support. We need strong support to meet these demands and accelerate the project. And for that, we need support of institutions, policymakers, but mostly also investors. So today, I hope that we are going to be able to raise enough money to bring out our projects and our goal for 2024. Thank you very much.
Thank you. You can pass it on. Thank you, Pushkarini. Very, very important work. Priya is up next from Health, Set, Go. And the same for you. Health, Set, Go.
Good afternoon. So I founded my organization Health Set Go based on my own lived experience and my struggle with my physical and mental health. What you see today is not how I was when I was a child. I was actually quite overweight, and because of that, I got severely bullied at school, which impacted my physical and mental health, as well as really impacted my self-esteem and body image. And when I did not get any support from my family or my school with regards to my health, I decided to take my health into my own hands. And as you can see today, I am a much healthier woman standing before you. But I know that this struggle was very long. And that is when I realized that if I knew as a child what I know today, maybe things would have been a lot different. And that is when I made it my life's mission to make sure that no child has to go through what I did. In fact, today, India has the second highest number of obese children in the world, and shockingly, we have 1/3 of the world's most malnourished children. This dichotomy is heightened only by saying that 70% of these children will go on to develop a non-communicable disease like cancer or diabetes if we don't intervene now. So it's critical for us to invest in the next generation's healthcare, but how do we do that? In fact, it's mandatory for every school in India to have a school-based health program and talk about mental health and physical health and do annual health checks, yet less than 1% of these schools actually have a health program. So seeing this gap is where I founded Health Set Go in 2016. And today, through our school-based health programs, we are impacting over 300,000 children across 77 cities in India. And I'll tell you how we do that. So our goal was to make healthcare standardized, accessible, and affordable in every school, so every school could become a health-promoting school. So we do that through our CARE program, which happens in 3 steps. Number 1, we have an annual health checkup for every child. Here is where we detect and diagnose over 90+ parameters for children. And this is not like any other health checkup. In fact, usually health checkups happen on pieces of paper, but we invested a lot in technology, and we built our proprietary healthcare platform for doctors so that they can assess and enter this medical information in an error-free way every time they do a health checkup at one of our schools. And this then gets translated into real time as an application and a website where parents and schools can assess and see their children's health progress, and any issues that happen are actually flagged there for parents and for schools. In fact, we also provide this technology inside the school, in the school medical room. So every time a child comes with a headache, a stomachache, it's all logged in for the 15 years that a child spends in school. In fact, we also log in vaccinations on this platform. And in case any medical emergency is detected, we offer a $1,600 insurance cover to every single child. And my favorite part is the health education program that we have that focuses on mental and physical health throughout the year. So I'll conclude by saying that we do this program in under $2 a year per child, and we're looking for partners in our journey ahead. Thank you.
Wonderful. You can pass it on. Thank you. Turning your own lived experience into your life's mission. Thank you. That's inspiring. Next up is Kalaivani from HELIXI.
This is the story of my family struggling to This is the story of my family struggling to communicate properly with a doctor on the symptoms and making this doctor taking the wrong diagnosis and giving them the wrong treatment. This is the story of my family, but not only. Hi everyone, I'm Vani from Elixir. I'm the CEO, former GP, and the founder of Elixir. My team and I want to remove the communication gap between doctors and patients, since medical words generate stress. Less than 10% of the patients are able to understand their doctors, and 80% of a diagnosis is based on the information given by the patient. So, health is intention, and in the consultation time of 8 minutes, it's quite hard for doctors to investigate about the information given by the patient. So, Elixir decided to connect the perfect patient with the perfect doctor. How? With our patient mobile app that helps the patient to prepare his consultation and teach him medical words. This app will be connected with our medical app, which will have a diagnostic helping IA for doctors. Our USP is to reunite patient and doctor without complexity when no solution does, and improve knowledge. Our business model is based on the monthly subscription for doctors on the market price of €100. Our market is GP for the medical app and patient, family for the patient app, We aim to reach 4% of the market, that means 4,000 GP, by 2027 to make more than €4 million and to help more than 60 million people. Now, just close your eyes and imagine. You've got the Elixir app on your phone. You prepare your consultation easily. You learn medical words every day. And when you have a consultation with a doctor, you just press a button to share the information you have chosen. During this consultation, you're able to communicate with him without stress because you're able to understand him. Isn't that wonderful? Yes, it is. So, to make that possible, we need partner investor from 10% of our capital. Thank you.
You can pass it on. Thank you, Vani from HELIXI. Up last, but not least, before the Q&A, is Joff from Laqi.
Hello, everybody. My name is Joff. I'm the CEO of Laqi, but some of you may know me from YouTube. I'm also a content creator who loves to make videos around modern health issues and package it into a short, sweet, but most importantly, as accurate story as possible. And well, the good news is I'm here to tell you one. In 1882, the citizens of New York made a discovery that would change mankind forever: electricity. But not randomly either. They found it through and along light bulbs themselves. It didn't take long for this new technology to infiltrate pretty much everybody's home on Earth. But this came with a price. Light is the main driver for your body's melatonin and cortisol production. Cortisol is known as the stress hormone for its effects on awareness, whereas melatonin is known as the sleep hormone for its effects on body repair and rest. Together, they essentially control your entire metabolism, your mood, your stress level, etc. But how does your brain do it? Well, how does your brain choose to produce one or the other? Well, it uses your eyes. It turns out that your eyes have a specific type of cells called iPRGCs that, when exposed to a certain amount of light, will immediately trigger cortisol production and consequently inhibit melatonin secretion. But when you turn off the lights, it's precisely the contrary that happens. The big issue is, for hundreds of thousands of years, our daily exposure to light followed a precise schedule. And it's no surprise that our body clock, also called our circadian rhythm, matches this cycle to the hour. That's why it was called that way. Circa means around, and dien means the day. So the rhythm around the day. But with the invention of light bulbs and later LEDs, our exposure to light has shifted tremendously. Is it a coincidence that nowadays most everybody tends to be chronically stressed and sleep deprived? Well, the research says no. And that's why we created Laqi Circadian, light bulbs that adapt their intensity and color in a 24-hour cycle automatically. They use your geolocation as well as your sleep schedule to give off the right temperature and intensity at every moment of the day. But how do they do it? Well, I'm glad to present Laqi, your digital butler that takes care of you and your house. Just place one of Laqi's eggs inside your house, and it will connect to up to 25 light bulbs up to 25 meters away in a flash. So easy setup, easy daily use, but most of all, easy on the eyes. We're looking for funds to start up for international expansion. So if you want to help Laqi hatch his eggs everywhere in the world, please come join us. Thank you.
Wonderful. You can actually stay with me. Yeah? Thank you for that presentation. I'd like to ask the other 4 pitchers to come back up on stage and maybe a little closer. We have about 7 to 8 minutes or so for questions. No particular order. Whoever wants to ask one, just signal it to me and I'll call you. Who wants to kick us off? Yes, please.
I have a question for HELIXI. You mentioned obesity at the beginning, and I just want to clarify if the health assessment, all the services that you propose is only for this disease, or is it for other diseases?
Thank you. Thank you for the question. So the health assessment that we do covers more than 90 parameters, but we, apart from checking for BMI, like which is going, trying to understand the malnourished state of the child, we also check dental care, eye care, and ENT. So we do a complete physical for every child. So obesity is just one aspect, but we also want to provide these checkups because a lot of the children actually don't even know when they have bad eyesight or when they're actually anemic or there's so many issues. So we actually provide a more comprehensive program for them.
Yes, please.
I have a question for Landcent. You were talking about generative AI and just maybe if you can detail this part of the product, because I didn't get if it was just for new drug discovery or something else that I missed.
Yeah, so a lot of our drug discovery is done on large libraries of data. One example we have is for thousands of years, traditional medicine has been used to treat a lot of things. And there's a lot of knowledge that exists within people's minds. And so we actually have a plan to verbally interview and record interviews with thousands of people across Africa and other countries, and then use AI to actually scan all of that information, find commonalities, and use that information to then identify new drugs.
So, hi, I had a question for Loba. I was wondering, so you're offering a new service, and I'm wondering in healthcare access is an important element. So how do the women who are in need of your service find you? What's your approach?
So thank you for the question. So we integrate ourselves in the global care pathway, and we provide the workshops in hospitals, in associations. So women from the hospital arriving in France, for example, in PASS, as we said in France, is like the primary healthcare services for women that has no, and men as well, that has no papers. They can have access through that sector. We also work with, as I said, medical and social centers, for example, drug centers or association that works with women affected by HIV. So this is how we integrate in this big path.
Thank you. Yeah, please.
I have a question for Laqi. How do you measure your impact on people, and especially because we do not spend that much time at home for some of us? So how does that work? And are you planning to go to clinical trials or kind of a?
We'd absolutely love to, definitely. We actually would look for people to help us do that. But to answer your other question, I do believe that since COVID, more and more people are spending time at home, and that's why we targeted it towards the individual instead of companies.
Yes, please.
I have a question for Landcent. I heard you patented, or at least you're in the process of patenting. So first, I wanted to congratulate you of thinking about your IP early on, your development. And regarding your patents, like, do you have a strategy? What is the strategy? Or is it offensive, defensive? What countries are you looking at? What global reflection you had for your IP? And it's okay if you don't have the answer.
I was afraid when I heard you were from IP that this question would come. So I think it's mostly defensive. It's just that as we're bringing technologies, we're trying to patent them. They're global, but our target market is specifically in Africa. So it probably doesn't answer your question to the extent that I need to. I'd love to have a legal person to answer that question for you. But yeah, as we're an R&D stage company, so we have a lot of new things that we are discovering, and it's absolutely important that we have the intellectual property to support that and defend that.
Thank you. Yeah, over here.
Question for the Elixir team. How many languages do you cover today, and how many doctors have you addressed so far using your app?
For the moment, we're only in English, in French, but we want to spread it everywhere. So we want to develop it in many languages. And what is the second question?
How many doctors use your app?
How many? Oh. For the moment, we're on the stage of MVP, but there is already 6 doctors who test it for the moment.
Yes,
and
please.
How did you define your price point and why €100?
We made 2 studies for that. One with a questionnaire for more than 300 people, patients and doctors. And after we made a one-to-one questionnaire for doctors to know how much they're going to pay for this kind of application.
And actually, this is the market price of all the applications. So definitely, the doctors are ready to pay this kind of amount. It's in the middle. So we don't want to upgrade or to downgrade the ID.
Thank you. We have time for 1 or 2 more. Yeah.
Yeah. So then, I had a question for HealthSetGo. So you mentioned that you made healthcare affordable. So I'm wondering, what is your trick to make it so affordable for the schools?
Yes, so we actually work very hard to make our entire offering of like an annual health checkup, doctors at school, insurance, health insurance cover for every child, and health education. It used to be $5 per child per year when we started, but now we've managed to bring everything down to $2 per child per year. And we do this because of, number one, economies of scale. We actually now have 300,000 children. For example, how we talk to our insurance partners, right? We tell them, you get to cover 300,000 children under your insurance policy. So you've got a pretty much unspeakable, like it's never been done before kind of rate. We actually customized our insurance policy that they've done just for us, so we're able to offer it at a very low cost. Apart from that, we have a lot of strategic tie-ups with hospitals. We work very closely with them, so we get the best doctors to go to different schools across the country through different hospitals with whom we have a fixed rate. So they only do it for a certain amount. And $2 is because we could have made it lower, we could have made it higher, but it's something that is very sustainable. So we've actually currently received no investor funding, and we are actually a profitable company. But now we're looking at further funds just to grow and expand into different geographies. But at this point, we're still sustainable as a company. So thank you.
Okay, wonderful. I'm afraid I have to cut it short at this point and ask you to put your hands together and give them a round of applause. Thank you so much. You will have the chance after the second round of pitches to meet with the jury members in the networking area and continue the conversation. But for now, thank you for your work and your presentations. Wonderful. Okay. Now, for those people who have just joined us, we are halfway through the pitching session in the field of health, and we have just heard from 5 amazing individuals and their work, and we're going to have 5 more just coming up. And without further ado, I'd like to welcome Elise from Zest for Life on stage.
Do you know that 25% of the people in this room live with a heavy secret? A secret that strongly affects their lives. 1 in 4 people deal with chronic disease or disability. Anxiety, depression, bipolarity, heart disease, cancers, diabetes. All of these are chronic disease. And these are not just statistics. They are real-life obstacles that strongly impact the lives of individuals and their loved ones. Picture this. You're trying to enjoy a dinner with friends, but pain is unbearable. You want to be patient with your kids, but you're exhausted. Or you're trying to be productive at work, but anxiety is overwhelming. It's just impossible. It's a circle of isolation that too many people find themselves trapped in. And we, at Zest for Life, we refuse this as the norm. A year ago, I met Elodie. She's a wonderful, shining, joyful person, a true Wonder Woman. Single mom of 3, an entrepreneur who's built and ran her own NGO for 12 years. No one would imagine that she does all of that while dealing with several diseases. And it doesn't come by chance. She got trained. She worked with the best doctors, dietitians, nurses, peers to set up the best program to live a great life with chronic disease. And it works. So Zest for Life is born from the will to spread this knowledge to all those in need. Our mission is very clear. We want to empower everyone to regain control over their lives, regardless of their health challenges. We want to enable everyone to live better with illness in order to live their lives to the fullest. We refuse to believe that health condition can define a person's potential. Our approach is very simple, yet revolutionary. We provide tailor-made programs that are a mix of human support and cutting-edge AI technology. Our participants work hand-in-hand with certified coaches to set their own goals and create actionable plans. Whether it's about managing pain, improving communication, or boosting self-confidence, our programs cover it all. We are Zest for Life. We go against the cliché. We talk about life and not about disease. And the very good news is that the results speak for themselves. Out of the 2,000 individuals we've supported, 96% claim a better quality of life after just a 3-month program. And on top of that individual transformation, we also have a huge societal impact. Lower healthcare costs, fewer cases of depression, and less sick leaves. The other very good news is that it's only the beginning. We are currently expanding. So whether you're a company willing to make your workplace more inclusive or an investor wanting to invest in a game-changing initiative, I am here today to start conversation. Together, let's rewrite the narrative. Let's talk about life and not about disease. Let's make a difference with Zest for Life. Thank you very much.
Wonderful. You can pass it on to the next. Thank you. That was Elise with Zest for Life, exactly to the point, on time. Thank you. Lucille is up next from La Maison de l'Artemisia. Welcome. Your time to shine.
Hi. Thank you. Thank you to be here and to hear for this incredible adventure. Imagine in your garden growing plants able to heal the most common illness affecting your family, your livestock, or your food crops. Your life as a small farmer would be radically improved. This dream is a reality. Artemisia annua and Afra can grow almost everywhere in the world. They are effective in treating human parasites such as malaria, animal parasites such as coccidiosis in chicken, either as a herbal tea or in powder. They also have proven properties against some bacteria, virus, fungus, and inflammation. Grown around houses, they repel mosquitoes. They spread so many diseases. Fermented, they provide an excellent biopesticide, non-toxic for the soil and for the water. So, Artemisia is the perfect plant for a One Health vision of public health. Our NGO, La Maison de l'Artemisia, helps to create training centers to spread these practices. It's a huge network of 130 Artemisia houses in 28 countries, creating partnerships with local NGOs. Artemisia houses have a real economic impact by reducing expenses on health, veterinary and phytosanitary products. They create a new local value chain. They also have a significant social impact by improving people's health, reducing absenteeism, and relocating work into the countryside. In addition, they have an environmental impact by reducing carbon emission from the pharmaceutical and crop protection industries. They also help to reduce water and soil pollution. To improve the impact of this local, effective, affordable, sustainable One Health solution, we are very proud to announce a partnership with the Haller Foundation via their application for local farmers, an app approved by the FAO. So join us.
Wonderful, thank you so much. That was Lucille with La Maison de l'Artemisia. Next up is Emily from Rofim. And there she comes. Stage is yours. Welcome.
Thank you. Hi, everyone. My name is Emily. I'm the co-founder of Rofim, which is a telemedicine platform. Oh, sorry. So why did we create Rofim? We created Rofim to have an impact, a positive impact on everyone's life, patient, but also professional. So we aim to promote an end-to-end solution. So at the same time, we want to help physicians to care for the patient. We also want patients to be educated with their disease once they know their diagnosis form. We want to support all the patients through the disease as well. How do we do this? We do this with a collaborative platform, which is available on app, but as well on web. We have like 4 different modules. The first one is tele-expertise. What is tele-expertise? It's the fact to connect physicians together to discuss about complex cases, chronic disease, and also like oncologies. So this is our first module. Second one is multidisciplinary team meetings. We believe that if we can do one-one, we can do one-to-many. The third one is teleconsultation. This is something you are all aware, especially since COVID. But what we do is we help chronic patients also to be able to stay at home to be cured. The last one is a DCC, and this is also for oncology. Our aim, as I said, is really to simplify both lives of healthcare physicians, but as well patients, because we are accelerating diagnosis. Since we are putting together physicians, we are decreasing the time to put a diagnosis by 3 right now. So we create Rofim to help and to federate healthcare facilities together. We are a mission company today, and we are trying to spread across the world our motto, which is to have an impact on the lead time to put a diagnosis. Some figures, because figures are really talkative. Today there's 38,000 physicians on our platform. More than 1,000 healthcare facilities are using us. And our footprint is already global. We are in Belgium, Ireland, Portugal, Morocco, Ivory Coast, and in a lot of French islands as well. I'm here today. I'm not here today to ask for money, but I'm here to ask you to spread the word. Each of you, you know a physician. Each of you, you are a patient, or you know someone suffering for long-term disease. So spread the word. Talk about us. Thank you.
Thank you. I think we can do you that honor and favor. Thank you. That was Lucille. No, that was Emily from Rofim. Up next is Tom from Bingley. Oh, there he is already. Your time to shine. Thank you.
Good afternoon. I'm Tom, co-founder and CEO of Bingley, the smartest medical interview on the planet. We use artificial intelligence to help guaranteeing access to care for everybody, everywhere, no matter your age, your gender, your geographical or socio-demographic background. Healthcare is facing a paradoxical problem. On the one hand side, let's say the global north, there's an overconsumption of unnecessary health. Around 50% of doctor visits can be avoided. There's a lot of diagnostic tests and even treatments that can be avoided. So this is not sustainable and it's health economically not very interesting. But on the other hand, in let's say the global south, there's underconsumption of healthcare because access to care is very complicated. The WHO estimates 10 million people, a shortage of 10 million healthcare professionals, especially in the global south. So how does a smart medical interview help in solving that problem? The people from Elixir already spoiled a little bit my point. We know that 80% of decisions in healthcare are based on the discussion between the patient and the doctor, what we call the history taking or the anamnesis. And that process sucks. It's very time consuming, it's inefficient, and it's frustratingly unwell prepared. So where do we come in? We use AI to mimic the way a doctor thinks, and we ask all the questions that the doctor will ask or should ask, but ahead of the consultation, so the patient has time to think, to answer the questions at their rhythm, in their language. So there was a question about the number of languages. We have 18 languages validated in our questionnaire, and it's all about ensuring that the right patient will meet the right care professional at the right time to get the right care. So how does it work? Very quickly, the patient will be invited by the hospital or the healthcare professional, so it's an invitation-based app. They will answer in their language, they have time to think. The physician, the hospital, the nurse will get a summary of the history taking, but then more importantly, on top of that, they will be presented actionable insights. So you have to think about a differential diagnosis, a triage score, a care orientation advice, what technical investigations to make, etc. So some of the proof of what we did, we interviewed more than 1 million patients. We are present in Europe and the US, in the UK. We have a differential diagnostic accuracy of more than 90%, including rare diseases. So a very important part of our business is to help speeding up the diagnosis of rare diseases. As I said, 18 languages. And on the right-hand side, you see the more, let's say, efficacy or efficiency numbers, where you can see that by saving time, we increase capacity, we increase access to care. So this is, I only have 5 seconds left. I don't have money to ask, but I think that we can talk a little bit later in the networking session. Thank you.
Wonderful. Thank you. You can pass it on to the next. Thank you. Last but not least, we have Yasser with us from Apon Wellbeing. Welcome.
Hello, everyone. Thank you. I'm Arafat. I'm one of co-founder of Apon Bazaar. So it's called Apon Wellbeing. So before I start, I would request everyone to think about 7-Eleven and it's inside the factory. So whenever you enter any 7-Eleven shop, whatever you are purchasing is discounted. And if you buy from there, you didn't need to pay at that time. It will be adjusted from their salary. And also, if you buy enough, $20 per month, then you're going to get free health insurance for next year. We did it possible at, that is at Apon. Sorry. So, and we did it for 7 million workers who earn less than $100 per month. Many of you may be wearing the textiles or apparels that's coming from Bangladesh. So we are doing, this is for them. And many of them actually can't get access. So at least 60% of them don't get access to credit. Even if they get payday loans, it's more than 26% monthly interest. And also, health, everything is a out-of-pocket expenditure. We don't have any health insurance, so that's basically fall them in poverty cycle. what we did is like we provide them up to 30 to 50% of their salary, which they can access either by purchasing grocery or can take the loan from us, and it's in 0 interest. Most importantly, what I told, like they can get up to $300 per year insurance facility from us. And we are not a charity. We are not doing it by taking money from donors. We are doing it by ourselves and by selling the goods, purchasing from the manufacturers. So let me tell a bit more. So what do? We make partnership with our factories, the apparel factories and the banks. If they purchase grocery or BNPL, then they save money from the discount. They get health insurance, and if they avail that insurance, they're gonna also have some income over there. So that is also helping the industry owner or the factory owners to reduce the absenteeism or turnover. It's creating new business for the bank, for those unbanked population, and that's how we want to make a sustainable sustainable business for us. So far, we have served 33 stores and 6.5 million USD worth credit got disbursed to 1,70,000 workers. More than 12,000 people got free health insurance from us, and also $35,000 plus claim we got settled so far. So what we are doing, like from the very first year, I mean from 2025, we will be in break even with a very high intention after operating 5 years in Bangladesh. So our strategic priority, obviously, to provide a health insurance to more than 1 lakh workers, and also to serve 1 million workers. Thank you.
Thank you. And you can actually stay with me. Stay. Yep. I'd like to ask the other 4 pitchers to come rejoin me on stage. Same procedure as last time. We have about 7 or 8 minutes for Q&A. Maybe to the right, just for the camera. And popcorn style, whoever wants to pop and ask a question, please go ahead. Yep.
I have a question for Bingley. Can you just detail your business model in a few words?
Yeah, so we charge, it's a SaaS model. We charge a fee per questionnaire, which is paid by or the provider, so the hospital. Depends a little bit on the healthcare system. In the US, it's paid by the payer, by the healthcare insurance. In Europe, it's or by the healthcare insurance, the mutualité, or the can be sponsored by a pharma company. Yeah.
Okay. Next one.
I have a question for Zest for Life. Make sure I do understand. It's just declarative answers from questionnaires that you send. That you send, and how you sell the application. Do you sell directly to B2B, either B2C, either via insurance, or?
Sure. So the product, yeah, it's declarative. So at the beginning of the program, we have a scientifically validated questionnaire that assesses your quality of life and many indicators that we follow. You would answer the same at the end of the program. So this is how we measure impact and how much we've helped you to live better. And how we sell today, we have 2 main selling processes. First one is B2C. So we have some people who purchase the program for themselves. And we have so that's B2C, and B2B, we sell through companies, and mainly they D&I, so diversity inclusion departments, or RSE, or DRH at large, that want to make their workplace more inclusive and empower these collaborators.
Thank you.
Thank you. Over here.
Yeah, one question for Apon Wellbeing. Yes. So I think I have understood the business model. It's sort of an Amazon premium, all included. Is there any difference in the retail price of the goods that the workers will buy?
Yes, that is. Let's say like this price or MRP is $100. So I am buying in $90 and I'm gonna sell in $95. So $5 as discount and $5 is like, that's how I'm surviving actually.
Okay, yeah.
I have a question for Bingley. So could the result of the questionnaire be, oh, actually your condition is not that serious, you don't need to see a doctor? And if that's the case, who would bear the liability for such an answer?
Yes, so indeed the triage, that's one of our main points, but the decision is always made by a healthcare professional. So we prepare them to make the right decision, but they make the decision. We never make automatically a decision that we communicate to a patient. So liability is on the part of the healthcare professional.
The lawyer just wanted to make sure of that.
I understand I'm also a lawyer, so.
Good question, though. Thank you. Yeah, next one.
I have a question for Rofim. So I understand that your go-to-market is in B2B with doctors or hospitals. Are you selling your services as a package, or can we choose the different functionality of the platform?
Thanks for the question. So actually, yes, I didn't deep dive on our business model, but we are selling to hospital, also to region, and also to some like association of physicians. So we have like different market strategy, and we can sell one module, we can sell a bundle, and for sure we apply a discount if we are more than 2 or 3 modules.
And are you working with insurer or not?
No, not at all. Since we are not addressing directly B2C, we didn't go on that path yet. Thank you.
And I have a question for Maison de l'Artemisia. So I was wondering how you decide on your scaling. So how do you decide where your next house is going to be implemented? Is it like a pool, or do you identify the needs?
Okay. We begin to be quite known in Africa. So people, they do connect with us, and they say, yes, I'm in a small village, we don't have any healthcare things, and I need a house of Artemisia in my village. So they are going in another house of Artemisia to make the training, to know how to grow Artemisia plants, and then they go back in their home and they grow. It's very simple. It's not app. It's just real life, and that's what we're doing.
Thank you. Wonderful. Any more questions? Yeah?
Maybe one last question to Apon Wellbeing. What is the ambition? Because we see a lot of players on BNPL. What is your positioning and how you want to grow in the future?
Yeah, actually, currently, as we are serving only the RMG workers, so our first ambition is to take it to the other industry in Bangladesh first and then scale it up. To do so, we have already launched our app. So let's say, like what he was telling, like on 7-Eleven, there is Amazon. We already put it. So that's our strategy to go to abroad. And by 2025, obviously, we'll serve 1 million workers, and with having the break-even, actually.
Big ambitions, but fingers crossed. Any more? No? Well, in that case, I would like to ask everyone to put their hands up and together and give these wonderful people a round of applause. Thank you so much. You are, as always, invited to meet in the networking area, including the 5 pitches at the beginning. The jury has one last tiny task, which is to vote on your coup de cœur, meaning the one pitch that you sort of like the most and want to send up on the main stage for another chance to pitch again. For the audience, we are going to be back here in just a few minutes at 3:30 straight for another round of pitches, this time in the area of circular economy. So don't go far away if that interests you, or come back straight after. We're going to start in a few minutes at 3:30.